Hello class, welcome to week 4 of our course. I hope you're all doing well and had a good week 3. Alright, I can't believe we're already at the halfway point in our course. It's crazy, it still astounds me how fast these online courses go. Alright, but because of that, we're moving right along. And this week is going to be another CAP assignment, your CAP 3, which is your muscle endurance and blood pressure assessment. Alright? So along with the CAP 3, you're also going to have a quiz due at its normal time on Sunday evening. All right. So let's go over your CAP 3 assignment. Your CAP 3 assignment is a little bit more detailed this week, and I have detailed it all throughout the instructions. There's quite a bit of explanation and directions of how things need to go for this assignment or for you to get full credit. So I highly recommend that you please review the instructions for this CAP assignment so you don't lose any easy points. All right? Okay, so because this assignment has a little bit more direction to it, I'm going to read through the assignment directions and explain it a little bit as we go through. If you have any questions in regards to this assignment, please make sure that you email me earlier in the week. It's sometimes a little bit hard for you guys to get your assignments done in the correct way when you email me later in the week, especially on Sunday and Sunday evenings. Doesn't leave you much wiggle room to make any mistakes, okay? Along with that, I would like you all to remember that you need to dress and behave professionally in these videos. These videos are not supposed to be kind of a casual, nonchalant thing. I need you to treat these videos as if you were going to be making a presentation either in the class in front of your classmates or professionally in a professional healthcare setting. All right, so that being said, I would like you all to please wear shoes. All right, a couple of you have decided not to wear shoes. I haven't deducted any points, but I will start deducting points for non-professional wear and not acting professionally in the videos. All right, so that's kind of your warning going forward to please make sure that you dress professionally, and along with that, make sure that you are enunciating your words, being very clear with what you're describing and explaining to your patient and to the video as well. All right? Okay, so your CAP 3. So now that we have our submaximal data collected, it is time to increase our client's heart rate and assess their muscular endurance. We will be combining previous skills learned to see how the heart responds under stress. For this week's CAP, you will film yourself proctoring and your client executing the ACSM push-up and partial curl-up test. In addition, you will be taking your client's heart rate and blood pressure post-assessment. So make sure you're definitely taking those 2 assessments after the actual assessment itself. Those would be areas where I would be looking to make sure you get the proper points for. Have your patient perform the push-up test first and curl-up test second. All right? You will be expected to follow that specifically. The reason for it being is the push-up test tends to not have too much of a, does not seem to affect the patient as much negatively in terms of taking away too much of their exertion and ability to actually perform the next test prior. When they've flipped it around, it shows that usually the clients will get a lower score on the push-up test if they do the curl-up test first, and vice versa. So they always kind of recommend that you do first the push-up and then the curl-up. If you do the curl-up first, they'll just be a little bit more exerted, a little bit more tired, and you may not get as much as a valid reading. So they recommend that we go with that. So for that reason, that is something that I'm going to expect you guys all to do. All right. So for reliability and validity purposes, it is critical to identify the setup, execution, common faults, and demonstrate each movement before your patient attempts. All right, so there is going to be an explanation portion to each of these assessments. So prior to you doing, I don't want you explaining the push-up and the curl-up assessment to me all at once. All right, I want to make sure that you're doing it prior to your client actually performing the test. So that being said, the first thing you're going to be doing, right? So like we said, you're going to do the push-up test first. You start your video, you do your introduction, and then you identify the setup, the execution, the common faults, and demonstrate each movement before your patient attempts the push-up test. All right? After they're done with the push-up test, okay, they're going to use that time to rest for the curl up, prior to doing the curl up test, you're going to be explaining the same things for the curl up test. That explanation time is your patient's rest time. So please make sure you are not explaining both tests to me in the beginning or at the same time. You need to break it up. That way you're explaining it all to the patient and you're all explaining it to me as well. All right, so this explanation and demonstration should be included in your video. Additionally, you need to take blood pressure and heart rate immediately after the curl up test. It is imperative that you practice explanation demonstration components before recording your videos. You should be clear and concise. All right, and I even put a note in there, your patient's recovery after the push-up test will occur while you explain and demonstrate the curl-up test. All right, so what's due? Proctor the ACSM push-up and curl-up test. Before the tests, clearly explain the setup, hand, foot, spinal position, etc. I want you to be going through the entire body, explain to me what's happening at every joint. Execution, what constitutes a good rep? All right, how would you, if you were actually doing this for a medical facility, which I do for some workers' comp patients when we do provide this test, what are you going to count as that was a proper rep and what's a rep that does not count? Explain that to me. All right, and common faults. There we go. Examples of reps that do not count. All right. Additionally, provide a demonstration for each movement. So I want to see you demonstrate it. So you're going to be demonstrating it for me and for your patient. All right. So those are points there too. So if you don't demonstrate it for me, you'll probably be losing some points. So please demonstrate it for me. Collect and submit data with classifications using the attached Excel spreadsheet and tables below. If some of you have seen your week 2 CAP assignment, a few of you lost points because you did not fill in that Excel sheet, that data card, and giving me the classifications. If you do not give me the classifications, you will be losing points. So make sure you're filling out the data card properly. All right, so along with that, I gave you guys the performance categories for the push-up test and the curl-up test. This should help you guys out to kind of pick that category. So I pretty much gave it to you right there. Categories are right there. So the Excel sheet data card should not be difficult at all. No excuse why you should not be able to put that in. All right, easy points. Don't lose those points. Okay, guys? All right, so that's your CAP 3 assignment. So along with that, you're going to be doing your quiz. If you have any questions, please let me know, and we'll go from there. And if you can hear that, that is my 2-year-old screaming for me, so I better go. If you have any questions, please come get me. All right, guys.